Good morning. Welcome. Thank you so much for joining us for the 2025 Texas State of Enrollment Conference. If you are in the lobby, I recommend if you are able to join us in the webinar to join us in this main room. In addition to that, we will be getting our slides up in just a moment. But before we get into the content of today's session, we are going to go through interpretation. We will be giving instructions in English, Spanish, and Vietnamese, so bear with us. And with that, I am going to be passing it to my colleague, Azucena. If we could also make sure that folks have access to sharing screen, that would be awesome. If not, I'm happy to share the slides.
And can you please start interpretation with Vic and Q? Thank you very much. Okay, so again, welcome everyone. I'm going to give the instructions briefly on how to access English, Spanish, and Vietnamese interpretation. If you go, can you go to the next slide, please? If you're joining us from a computer, please go to the bottom of your Zoom screen. You're going to see a globe that says interpretation. You click on it and you'll be able to make your language selection. Next slide, please. If you are joining us from a computer, from a phone or a tablet, please look for the three dots that say more. There you're going to see the option to choose language interpretation. If you click on there, you'll be able to make your language selection. Make sure you click done after you have made your selection. So it takes. I really want to encourage everyone that is not bilingual to choose a channel. I'm going to ask Vic to go briefly and just say hi in the English channel so those people that are there, make sure that you can hear him. And if not, let us know. Thank you. And now I'm going to give instructions in Spanish. Buenos días otra vez. Estamos ofreciendo interpretación al español y al vietnamita, interpretación simultánea para las personas que necesiten este servicio. Si por favor si están desde su computadora, ven la parte de abajo de su pantalla de Zoom, van a ver un globo que dice interpretación y hacen clic ahí y pueden elegir su idioma de preferencia. Next slide, please. Si nos están acompañando desde su celular o desde su tableta, busquen los tres puntos que dicen más. Ahí van a tener acceso al menú que incluye interpretación de idiomas. Si hacen clic ahí, van a poder elegir su idioma de preferencia. Y aquí hay que hacer clic en listo para que funcione. Brevemente le voy a pedir a mi colega Vic que se vaya al canal de español. Las personas que están ahí, si no lo pueden escuchar, por favor, díganos en el chat. Thank you. And thank you so much. And now I'll pass it on to my colleague, Hoy.
Thưa quý vị biết là cái hội nghị có hỗ trợ phiên dịch. Nếu quý vị đang dùng máy tính thì bước 1, quý vị nhìn góc bên phải thì bấm vào quả địa cầu. Bước 2, quý vị nhìn về bên trái thì các quý vị chọn ngôn ngữ mình muốn là tiếng Việt Nam, Vietnamese. Và bước thứ 3 là quý vị nhìn thấy bên góc tay phải ở dưới, quý vị bấm vào tiếng Việt Nam. Nếu quý vị mà truy cập từ điện thoại di động cũng 3 bước. Bước 1, quý vị bấm vào chữ more, có 3 cái chấm nhỏ ở trên, quý vị bấm vào chữ more. Bước 2, quý vị bấm vào ngôn ngữ phiên dịch là tiếng Việt. Và bước 3, quý vị bấm vào chữ done và thế là xong.
Thank you. Can we please be made interpreters now? Thanks.
Thank you so much to our interpretation team for ensuring this year's conference is accessible. In addition, we would like to give a special thank you to the St. David's Foundation for their generous support sponsoring our language access for today. Translated resources and all of our materials will be available post-conference. Again, if you are watching in the Zoom lobby, you are more than welcome to stay there. But if you would like interpretation services in Spanish or in Vietnamese, I strongly encourage you to join us in this main webinar space. And also that's an invitation to anyone who is currently in the lobby. If you would like to join us in this main lobby space, in this webinar space, we would love to have you. On your screen right now is the schedule for the Texas State of Enrollment Conference. All of the times for our schedule are in Central Time. Welcome to session 2. And as a reminder, all video recordings and our slides and resources that we share during the conference will be available post-conference in English, Spanish, and Vietnamese. And then with that, I will be passing it over to my colleague, Sonia, to get us started.
Good morning, everyone. My name is Sonia Lada. I'd like to thank you all for joining us on the second session of the Texas State of Enrollment Conference. The title of this session is Special Enrollment Period, Deep Dive. So best practices and communication with care. I am the Outreach Director at the Texas Association of Community Health Centers. And today I am joined by Claire Hayesen and Senior Policy Analyst for Health Insurance and Marketplace Policy at the Center on Budget and Policy Priorities. And also Ariana Anaya, who is a healthcare consultant and former Texas assister. We're super excited to have you all both joining us today. The full speaker bios are on the Zoom events page, and our chat monitor has just dropped that link. Thank you. If you want to read more about our speakers in this session and for the whole conference. So a quick little overview of our session today. Enrollment assisters should expect challenges and more hurdles for individuals seeking a special enrollment period. This session will provide an overview of changes to marketplace special enrollment periods, a refresher on existing special enrollment periods, and new restriction requirements, as well as best practices on completing a successful special enrollment application. Finally, our session will end by covering some valuable tips and strategies for assister self-care, as well as communication with care and empathy for individuals that lose coverage. So this session's learning objectives are: first, we hope that you will understand federal policy changes to marketplace special enrollment periods. Second objective is that we hope you will learn some best practices for submitting a successful SEP application. And finally, we hope that you will gain some communication with care skills to help support newly uninsured individuals. With these learning objectives in mind, we would like to remind attendees to stay until the end of the panel to complete a quick poll for a chance to win a $50 gift card after each session. But you must complete the Zoom poll to be entered. For those of you in the lobby, please make sure that you enter the webinar space so that you can participate and get a chance to win. Lastly, there will be a little more time, hopefully, at the end for Q&A after each speaker's presentation. And so with that, let's go ahead and get started. Claire Hayesen, a Senior Policy Analyst for Health Insurance and Marketplace Policy, is at the Center of Budget and Policy Priorities. She's going to speak on policy changes to the SEPs, the best practices and strategies for successful SEP applications. So without further ado, I'll go ahead and pass it over to you, Claire.
Thank you, Sonia, and thank you everyone for being here this morning. Today I'll be talking about special enrollment periods in the ACA marketplace. Now I know we're heading into open enrollment now, and so a lot of the focus will be on that. But special enrollment periods, also known as SEPs, are a complicated topic and they can be accessed year-round, including during open enrollment. So I hope you'll find this refresh helpful. Next slide. First, I'll be providing an overview of common elements of special enrollment periods before getting into common events that trigger a special enrollment period. Then I'll be talking about some new policies that will affect special enrollment periods. There's a lot of ground to cover when it comes to SEPs, and I only have 30 minutes. So the wonderful conference organizers will also be dropping resources in the chat throughout the presentation that may be helpful if you'd like to take a deeper dive into a particular SEP or topic. Next slide. Next slide. To start off, a special enrollment period is a period when someone who experiences a qualifying life event can enroll in or switch marketplace coverage. People can access a special enrollment period at any time of the year, either during or outside of the annual open enrollment period. Next slide. There are a number of different qualifying events that can trigger a special enrollment period. Here, I've grouped them into categories. The first is loss of other qualifying health coverage, including employer coverage, Medicaid, and many other types of health coverage. Special enrollment periods can also be triggered by changes in household size, such as marriage, birth, or adoption of a child. They can be triggered by changes in a person's primary place of living or eligibility for financial help. So, for example, if someone moves out of the Medicaid coverage gap, newly gains eligibility for the premium tax credit or cost sharing reductions, or newly gains an immigration status that makes them eligible for financial help. Less commonly, people can get a special enrollment period if they experience error or misconduct by a broker, a marketplace representative, or an insurer, or if information about their health plan is displayed incorrectly. Finally, there are other circumstances, which can cover a lot of different situations, including special enrollment periods for survivors of domestic violence and people impacted by a FEMA-declared disaster. Next slide. Okay. In many cases, people will be able to access an SEP just by filling out or updating their marketplace application. For the most commonly used SEPs, if someone is already enrolled in a marketplace plan, they can return to their application and report a life change, and then go through the application and edit the information that has changed. If they're not enrolled in a marketplace plan, all they have to do is start a new application. Once the application is completed or updated, they'll receive an eligibility determination notice that will inform them of whether they're eligible for a special enrollment period. And healthcare.gov also has a screener tool that you can use to determine in advance whether someone might be eligible for a special enrollment period without having to go through the entire application. Next slide. However, some special enrollment periods require a person to contact the call center or a caseworker. Those special enrollment periods are listed here. Next slide. SEPs are generally available 60 days after a qualifying event occurs, though some special enrollment periods are also available for 60 days before the qualifying event. This is known as advance availability. In many cases, the first day of coverage will be the first day of the month after a person selects a plan. However, some special enrollment periods can begin retroactive to the date of the qualifying event. If a person wants retroactive coverage, keep in mind they must pay premiums for all months of that coverage. Next slide. To qualify for certain SEPs, the person experiencing a qualifying event must have had minimum essential coverage for at least 1 day during the 60 days prior to the event. There are 2 exceptions. First, if the person was living in a foreign country or U.S. territory in the past 60 days, or if the person is a member of a federally recognized Native American tribe or is an Alaska Native, referred to as AIAN for short. In these cases, people do not have to have prior coverage for at least 1 day during the 60 days prior to an event. Next slide. And before we get into examples, I just wanted to mention that there are special enrollment periods for other types of health insurance, and the rules for these special enrollment periods, in most cases, are not the same as the rules for the marketplace. So there are special enrollment periods for Medicare, employer coverage, and COBRA. Today's presentation will focus on marketplace special enrollment periods only. Next slide. Now I'll go over some common events that trigger a special enrollment period. These slides come from a longer presentation that includes less common events that trigger a special enrollment period. And hopefully someone will pop a link to that slide deck in the chat. Feel free to have a look if you'd like examples of some of those less common SEPs. The longer presentation also has more information about plan selection limitations, which I won't have time to cover here today. I'm also happy to answer questions on these topics during the Q&A. But without further ado, let's get into the commonly used SEPs. So the most commonly used SEP is the SEP for loss of other qualifying coverage, and there are examples of other qualifying coverage here. This special enrollment period is available up to 60 days before or after a loss of coverage, or if someone is losing Medicaid or CHIP, they can access this SEP up to 60 days before or 90 days after loss of coverage. It's important to note that this SEP does not apply in cases where a person voluntarily drops their health insurance coverage or has their coverage terminated because of a failure to pay premiums. Next slide. And I won't spend too much time on these examples, but here's an example of the coverage loss SEP. So Miles, Jayla, and their daughter are enrolled in health insurance that Miles gets through his job. Miles quits his job in July, but his insurance is scheduled to end on July 31st. So the family is eligible for an SEP beginning in June and going through September. If Miles and Jayla are prepared and select a plan before their employer coverage ends, they can get marketplace coverage with no gap. Next slide. Miles and Jayla will still get an SEP 60 days after their employer coverage ends, but they will have a gap in coverage because marketplace coverage will begin the first day of the month after they select a plan. Next slide. There are also special enrollment periods for marriage, birth, adoption, foster care placement, or court order. These two SEPs are available up to 60 days after the qualifying event occurs. Current marketplace enrollees can use these SEPs to add a new child or spouse to their current plan or enroll a spouse or dependent in a separate marketplace plan. Of note, the SEP for marriage does have a prior coverage requirement, so at least one spouse must have at least 1 day of minimum essential coverage in the 60 days prior to the marriage or fall under one of the two exemptions. Coverage for the marriage SEP will begin the first day of the month following plan selection. Meanwhile, the birth SEP does not have a prior coverage requirement, and coverage will automatically begin retroactively to the date of the qualifying event. If someone wants the SEP to start on the first day of the month after plan selection, that's also possible, but they must call the marketplace to request that change. Next slide. So here's a quick visual of how retroactive coverage works. In this example, the child is born on July 31st. His parents have a marketplace plan and add the baby to their plan in August. By default, the baby's marketplace coverage will begin retroactive to his date of birth in July, so long as his parents pay marketplace premiums for him for any months of retroactive coverage. Or, alternatively, they can call the marketplace and request that the baby's coverage begin in September. Next slide. There's also an SEP available for a permanent move. Importantly, this special enrollment period only applies if a person is gaining access to a new marketplace plan as a result of their permanent move. So if someone is moving down the street and their zip code and their county isn't changing, it's unlikely that they would be eligible for different marketplace plans than they would have had before, so they probably wouldn't be eligible for this special enrollment period. The special enrollment period also applies to people who are moving to the US after living outside the country or in a US territory. This SEP has a prior coverage requirement, is available up to 60 days after a permanent move, and coverage begins the first day of the month after plan selection. The date of the qualifying event is the date of the move as defined by the person moving. Next slide. This is a quick example. In this situation, the family moves to a new state on September 8th. In order to be eligible for the SEP for a permanent move, at least one person in the family must have had coverage in the prior 60 days. Although this family was uninsured in August, they did have insurance in July, so they would meet the prior coverage requirement. Next slide. Now let's talk about the SEPs for changes in eligibility for financial help. As you may know, people are not eligible for premium tax credits if they have an offer of employer coverage that is both affordable, so that's 9.96% of household income in 2026, and meets the minimum value standard. If someone's employer coverage changes, such that the employer no longer offers any plans that meet the minimum value or affordability standards, the employee and their dependents become newly eligible for the premium tax credit and are eligible for a special enrollment period. This can happen if, for example, an employer stops making contributions to an employee's health plan, or if the employer changes which plans are available to their employees. This SEP is also available to an employee's family members who are newly eligible for the premium tax credit because of the change in the affordability test for family coverage, also known as the family glitch fix. And I believe Sara is going to drop more information about the family glitch fix in the chat. It's important to note that people must drop their employer coverage before the coverage effective date for marketplace coverage in order to receive a premium tax credit. This SEP is available up to 60 days before and after loss of coverage, and coverage begins on the first day of the month following loss of coverage or plan selection. Next slide. There are other ways that people can newly gain eligibility for financial help, and for the sake of time, I'm not going to go into detail on all of them right now, but a few important things to note. Number one, the SEP for newly gaining an eligible immigration status that made them ineligible for marketplace coverage, for example, like DACA, and they gain an immigration status that makes them newly eligible for marketplace coverage. This SEP doesn't apply if someone is already eligible for the premium tax credits and then gains a new immigration status under which they continue to be eligible for the premium tax credit. Another thing to note is that the American Indian and Alaska Native SEP allows people to enroll or change health plans once per month, and that is at the moment unique. Finally, there are 3 SEPs in this category that have a prior coverage requirement, and they are the special enrollment period for becoming newly eligible or ineligible for premium tax credits, a change in cost sharing reduction eligibility, and that includes moving between different cost sharing reduction plan levels, and becoming newly eligible for the premium tax credit after a decrease in income. Oh, and I zipped over to the next slide. Sorry. Next slide, please. While all 3 of these SEPs can be triggered and has a change in income, the SEP for becoming newly eligible or ineligible for the premium tax credit, so the first one on this bulleted list, also applies if a person resolves a failure to reconcile issue and becomes newly eligible for the premium tax credit as a result. Finally, and I apologize, I don't have a slide for this, but there is an SEP for people who move out of the coverage gap. So in states that haven't expanded Medicaid, like Texas, this SEP applies to people who were previously ineligible for the premium tax credit, solely because their income was below the poverty line, and they experience a change in income or household size that brings their income above the poverty line. This SEP does not have a prior coverage requirement and is available 60 days after the change in income or household size occurs. Next slide. Now let's get into some new policies that will take effect this year that affect special enrollment periods. Once again, these slides came from a longer presentation, and someone is going to drop that into the chat in case that is a helpful reference to see the full suite of policies that are going to be changing this open enrollment and over the next few years. Next slide. All right, so quickly, just a guide to what you're looking at here. The light blue box here highlights what the policy was like before the regulation or law change. And then that little box in the corner indicates whether the provision is scheduled to sunset at the end of 2026 or whether it's permanent. I do want to note that Congress or CMS can choose to extend sunset dates or make a policy permanent. So this is sort of what the policy is at the moment. It doesn't guarantee that that the sunset date will be on the 31st of the next year. Also, some of you may have heard that a federal court put a temporary hold on some of these new changes, and I'll note when that is the case, and those slides will be marked with a red asterisk. Even though some of these changes are not currently in effect, I wanted to mention them because I know there's a lot of information swirling around and it's confusing which of these changes are happening and which aren't. So hopefully wanted to add some clarification there. As many of you are probably aware, for the past several years, there has been a year-round special enrollment period for people with income at or below 150% of the federal poverty level. As of August 25th, 2025, marketplaces are no longer able to offer this as a person's income that doesn't correspond to another life change. This provision affects all states and is scheduled to sunset on December 31st, 2026. Next slide. CMS also planned to require people to submit documentation to prove their projected income if there's no tax data available for them, or if they attest to income that would make them ineligible for the premium tax credit, but federal databases show that they have income below the poverty line. This change was supposed to take effect on August 25th, but a federal court stopped this policy from taking effect. So it is not in effect at the moment and will not be until the court case gets decided. Next slide. As a reminder, if someone does not have pay stubs or other documents that prove their income, they can submit a signed statement, including their household income information and an explanation for their income projection. And this will still be the case should the new policy for income verification go into effect. Next slide. Next, and this is one of the new changes that has already taken effect, there will no longer be an automatic 60-day extension to the 90-day period to resolve income inconsistencies. These extensions will now only be granted on a case-by-case basis. This policy took effect on August 25th. It impacts all states and it does not have a sunset date. Next slide. This next change will take effect in plan year 2026. So under a new law, people who enroll in marketplace coverage through an income-based special enrollment period that is not connected to a life change, such as the low-income SEP, will no longer be eligible for premium tax credits. This will go into effect after the low-income SEP has already gone away and after open enrollment has happened. So we don't expect peaks, but if the low-income SEP were to come back, this part of the new law would make it very unappealing to use that SEP. So based on income and are not connected to a life change. So people who enroll through the SEP for becoming newly eligible or ineligible for premium tax credits or cost sharing reductions will not be impacted because those are connected to a life change, a change in income or household size. Similarly, the monthly special enrollment period for Native Americans and American Indians will not be impacted as that is not an income-based SEP. This change will take effect in all states and does not have a sunset date. Next slide. Currently, healthcare.gov requires people to upload documentation to prove that they qualify for the special enrollment period for loss of qualifying coverage. A person's coverage does not begin until they complete the verification process. For plan year 2026, CMS wanted people to upload documentation for additional special enrollment periods, so marriage, birth, adoption, or court order, permanent move, and Medicaid or CHIP denial. But a federal judge has paused implementation of this new policy, at least for now. Next slide. Sorry, next slide. Thank you. And this is a screenshot from healthcare.gov showing that additional verification is needed to access the SEP for loss of minimum essential coverage. The website notes that this coverage won't start until documentation is submitted, so important. And this is the current process for SEP verification for the loss of minimum essential coverage. And this is what people will be required to do for other SEPs if the new policy change goes into effect. So our friend Rachel here submits a marketplace application and selects a plan. She's then prompted to submit documentation to confirm eligibility for a special enrollment period. She'll have 30 days after plan selection to submit documentation. The marketplace will pend her enrollment until her documentation is verified, meaning that her application and plan selection will be kept in the system, but her coverage won't actually be able to begin until her documentation is verified. If Rachel's documentation is rejected, she'll receive a 30-day extension to resubmit, and she can receive up to 2 extensions for a total of 90 days maximum. If Rachel does not submit verification during this 30-day period, she can start the process over as long as she is still within her SEP window. After the marketplace accepts Rachel's verification, she must pay her first month's premium to start coverage, and coverage generally will begin on the original coverage effective date for the SEP. If the SEP verification issue is resolved after the original coverage effective date, coverage will begin retroactively. Sorry to hear that I'm skipping. I'm not sure what to do about that, but I only have one more slide left. So can we move to that last slide? Thank you. I'm not going to go over this chart in detail, but I do find it to be helpful in referencing the different enrollment impacts, deadlines, and consequences related to SEP verification, data matching issues, and identity proofing. And this chart can also be found in the, like a version of this chart can be found in the CMS slide deck that someone should be dropping in the chat. Next slide. Oh, this one should not be in the presentation, so we'll go to the next slide after that. Great. All right, so I think we're doing Q&A at the end of this session. So I think for now, I will turn it over to, oh wait, sorry. I forgot I had resources to share. Next slide. So this is a resource that I have bookmarked and refer to all the time. It is the Beyond the Basics reference chart, guide to special enrollment periods, which includes the circumstances that trigger an SEP, who can trigger an SEP, the coverage effective date, plan selection limitations, and how to access the SEP. So that's in the chat now, and highly recommend you take a look. Next slide. Our partners at Community Catalyst also provide a variety of print and digital SEP outreach resources. Next slide. And here is a number of additional resources on special enrollment periods from both healthcare.gov and Beyond the Basics. We're not going to drop all of those in the chat, but I believe these slides will be available afterward, and all of these resources are linked there. Next slide. And if you have any questions, please feel free to reach out. My email is up on the screen. You can also email the Beyond the Basics inbox. Myself and my colleagues check that, and that's typically the fastest way to get an answer because you have multiple people looking at it and responding to it. And I believe that is the end of my time.
Great, Claire, you finished right at your 2-minute warning, so a little bit before. I did recognize that you did come in and out a little bit, but there's really nothing we could do other than just, you would freeze up just a little bit, but hopefully we will share the slides and people will reach out if they have any questions. I do apologize also, there was a slide on the Medicaid gap initially, but for some reason it did not make it over to the slide deck when it was transferred over, so I apologize for that. So we'll make sure that the full slide deck is available for everyone at the end of this session. So I will go ahead. I do have a question here that came up during the session, but I believe Lynn answered that. Did we need me to go over that question? I'd like to, I think, because I didn't see it, but it says the question is, so you need income to be above 150% of FPL plus a life-changing effect to qualify for a special enrollment period? And Lynn's response was, no, people can get SEPs as long as they have a qualifying life event. And if they qualify for APTCs based on their household size and income estimate, then they can use the APTC during the SEP to subsidize their coverage. But there's no income requirement for SEPs, although SEPs do depend on applicants' new eligibility for premium tax credits, which can shift based on moving from income under 100% to income over 100%. So I just wanted to make sure I responded that. And yeah, somebody put that in the chat. And I read it, so sorry. So go ahead. Well, thank you so much, Claire. I know you're going to stick around and make sure that if there are any questions, you're available to answer those. I'm going to go ahead and shift gears, and we're going to go to our next speaker, Ariana Anaya, who is our consultant and also a former Texas sister. Worked here in Texas, actually in Austin. So many of you are very familiar with her. She has provided a lot of great training around marketplace and marketplace, just walking through the application itself, or even just comparing and selecting plans. She's a great resource to us. We're really happy to have her here with us. She is going to talk to us about skills to help with your communication to individuals who are experiencing loss of coverage, and also just some self-care tips for many of us, because it is a trying time for many of us with all the changes that are happening. And so we want to make sure that we take care of ourselves as well as our clients. So without further ado, I'll go ahead and pass it over to Ariana.
Thank you so much, Sonia. Thank you all very much for being here. It's really an honor to be in any way associated with Texas State of Enrollment. I do presentations for a lot of different states, and I always say to Texas sisters that y'all are some of the best. And I think it's partially because of what Sonia just pointed out, that there's a lot of challenge to assisting in Texas. I live up in Vermont now, and what the ACA looks like is a little bit easier to navigate because of the expansion of Medicaid and whatnot. So we've weathered a lot of challenge before, and we will continue to do so. My hope today is just to provide some ideas, some thoughts, probably nothing that people haven't thought of, but just some best practices that we utilized when I was managing the Foundation Communities, a sister program in Texas. So without further ado, we're gonna, next slide, thank you. So kind of a loose agenda. These areas bleed into each other, and I don't really have headers for each section. But I think as we approach a season where there is a little uncertainty, there is the possibility, and I really want to focus on the word possibility, that the extra financial assistance that was made available is going to be renewed. But it's also probably more possible that it is not. So we're approaching this season without necessarily 100% knowing what January will look like financially for consumers. And that makes it a little tricky. So we've had this kind of uncertainty before, and I'm going to reiterate some of those old lessons because they're useful, but also because a lot of them really worked. And we always want to remember the history of what we've done to keep up with what's happening now. Next slide, please. I've probably used the image in the right-hand corner before just because it amuses me. But I think there's something really beautiful to that idea that we shoot for perfection and we kind of often end up with a bit of a mess, so to speak. I just imagine being the baker who tried to make that SpongeBob SquarePants cake and just that how you would probably feel. But the reality is when people eat that cake, they don't care. And so I think sometimes understanding that uncertainty, when we're clear about it, can actually be really beneficial to clients and can actually help instill their trust in us. As much as possible, I think it's a good idea to give clients a heads up when it comes to what we know. This is not instilling fear in anybody. We're letting them know that things might look a little different when they sit down in the chair to get enrolled or when they work with us by phone. And so I have kind of a suggestion for how you can word this, but of course that should be checked on with your organization. But one thought is to say, just so you know, premiums for 2026 may be higher. We're going to walk you through what those options look like. Please be aware we are not responsible for those price changes because money is an emotional thing and people react emotionally when they don't understand why something is much more expensive than it was previously. So as much as we can set the stage to just kind of give them that heads up and to set that expectation that there's a bit of uncertainty. So that's my recommendation for setting appointments. When you actually sit down with the client as an assister, I would reiterate this. I would recommend making mention of the fact that this might be a different year financially, but again, it is 1 year. We want to prepare for the immediate future and not panic about the whole potential trajectory of health and time. That doesn't do anyone any good. So I would reiterate that potential cost increase, letting them know there's some changes to the financial assistance. Always, if that seems to put them off, let them know there is a estimator tool that you can use to show them plans before going through the whole application. That can be helpful if you start to see someone reacting very emotionally or angrily right off the bat, because you can show them and give them answers a bit quicker. So this, again, you don't need to do with every customer, but it's a good idea if you're starting to sense that a client's going to have challenge with this. Claire just gave us such a beautiful overview of all the different SEPs. Clients won't necessarily remember those details. That's for you to remember, but making sure they understand, hey, check in if something changes, especially if they're opting to go uninsured for financial reasons. And then finally, I'll talk more about this later, but if the client is financially needing to go uninsured connected to the cost, make sure they understand this doesn't mean they're completely out of the health network or, you know, continuity of care, or there are resources, right? We don't talk very much about how to get care in America if you're not insured, but there are routes. And I know especially those of you who work in FQHCs will have a great sense of this. I'll get into some of those a bit later, but let's keep that in mind. Obviously, you know, we're not trying to sell them something. We're trying to ensure that they know and understand their options. Next slide, please. So to get a little bit into some options, and these obviously are very broad, and I apologize for that. First and foremost, of course, we have Medicaid and we have CHIP, two slightly different programs. But of course, these are in Texas primarily going to be available for children or for pregnant women under a certain income amount. Medicaid, of course, tends to be on the lower end of the income eligibility spectrum, whereas CHIP Medicaid tends to be, CHIP tends to be a bit higher, closer to the 200% FPL amount. So those, of course, are programs that offer coverage per se, the exception being CHIP perinatal, which is primarily there to treat the needs of the unborn child. So less for the mom and her health and more for the baby that she is going to theoretically have. Not a terrible distinction to make sure clients understand if they are getting to essentially choose between CHIP perinatal versus a regular QHP. Below that, I'm mentioning the federally qualified health center sliding fee scales. So there are, of course, clinics throughout Texas where clients should be able to go regardless as to whether or not they have health insurance. And a lot of people, particularly middle income people, don't really know of the existence of these places or may not understand that this is intended to be a resource for someone uninsured, that it's not just for quote unquote poor people, right? This is exactly what this is for. I'm right now in a state where, as an unemployed person, I get Medicaid. That's very weird to me as someone who lived in Texas for 8 years. But we, of course, don't have that. And it's important people understand that this is what they have as an alternative, and it is for them. It's not for some specific type of other person. Like, it's there for when you need it. Let's make sure you understand how to use it. Finally, there are county-based indigent healthcare programs throughout the state of Texas. And essentially, I think Travis County, which is where my old stomping grounds, had a program called MAP. And because this is funded by local tax dollars, MAP had a very generous eligibility cap. I believe people were, when I resided there, eligible up to 100% of the federal poverty level, with certain populations being eligible even higher. That is not the case across Texas. Let's be clear that a lot of Texas counties are quite small and don't have that kind of funding. And eligibility may only go up to something like 28 to 30%, depending. But some of these bigger counties do have those options. And I'm sure those of you who are working in each county are aware. You know, check in with the client, make sure your client has heard of it. Again, especially if they are kind of newly in a challenging financial situation, which many people are, right? This is the word indigent is kind of, I think, not the funnest thing to say to people, but being able to name the program, all right, will help. I think I'm seeing half a comment about Hays County and how small, and that is exactly right. I listed the 3 that I know of that tend to have eligibility up to or around 100%. But yes, a lot of rural teeny counties, it is virtually impossible, as the comment stated, to qualify. You have to have almost zero income. So please be aware that this is only something I would recommend, all right? This is only something I would recommend specific to knowing that the program might be useful to a client. Okay, and then finally, and this is kind of, I've put it in red text because I think this is what clients need to know about in terms of the worst case scenario. Hospitals receiving federal funding, which is going to be most big hospitals, are actually required to offer what's called, again, not the greatest language, but charity care. This is not something the hospital will necessarily advertise, but generally speaking, if you're uninsured as you check out, you'll receive a wealth of information from typically some kind of financial someone or other. They might call, they might give you a packet, it kind of depends. But if the client requests of the hospital that they would like an application or they would like more information on any kind of financial assistance, or they can use the term charity care, and they are uninsured, depending on their income, it is likely they can qualify for some assistance. I've seen people with emergency bills of like $40,000, $50,000 get such significant assistance from hospital charity care that it essentially nullified the entirety of that bill. So this is nobody's first recommendation, obviously, but if something happens, it is so important that clients know, because that's what that funding is there for. Next slide, please. So in terms of the now, right, what can we do now? We don't know what's going to be the case financially for 2026, but we do know there's a possibility that someone might need to opt out of insurance based on cost for 2026. I cannot say this enough, and I did this myself and for my partner at various points of time. If you know your coverage could end, or that there might not be stability in terms of what your coverage is or covered, get yourself serviced. And I say that like getting a car serviced, which maybe isn't the best way to put that. But I live now in Vermont, and if you don't get those tires changed, seasonally, you're going to have a very hard time driving here during the winter. And I think sometimes it is helpful to engage the client in understanding their health as something they need to maintain, just like their home, just like you got to get the checkup, right? You've got to be engaged in this preventative care year round. And this is sometimes a way we can really incentivize them. I recommend having a conversation with your provider now, letting them know, well, I'm sure you've seen in the news, doctor, that there might be some price changes to certain insurances. What can I do? Are there any affordable self-pay options? It's possible that this person has a provider who won't see them uninsured, but some doctors will, right? It all depends on the specialist. Be honest with your doctors, I think, well, with the office of the doctor as much as possible, because there are sometimes options. But more than anything else, it will help you potentially get an appointment sooner rather than later. Finally, GoodRx, I think, has become kind of known as a mode of locating coupons, but I always encourage its use for pricing medications. It can show you within a given area which pharmacists have the best deal for a medication specifically based on your zip code, based on the pharmacies in your area. So a client could actually pick the pharmacist locally that has the lowest price on a certain medication. And it always shocks me. Like, I was looking in my area, and getting, say, lithium at Walmart up here was quite a bit more expensive than getting it at the local, like down the street mom and pop shop, which really surprised me. You'd be shocked by some of these price. I mean, the logic for it, we won't get into now, but always a good idea to advise someone on medications to take a look at that, or to help them take a look at it. Final thing, if you have a client who's opting or needing to opt to go uninsured for 2026, make sure, as politely and correctly as possible, to be inquisitive about the known medical needs. So you're not just prepping them sort of vaguely. Because if you have a family member who is ill and in treatment, let's say chemotherapy, we don't want them to suddenly be off treatment. It might be possible, to just put that one person in a plan. Okay. But the other piece is that even if you need to put that person in a less expensive bronze or catastrophic plan, you can usually, with most providers of that kind of specialty care, set up a payment plan so that even if you have to pay off a $5,000 deductible, you're paying it in installments gently over the course of time, and it's not interrupting your treatment. So keep that in mind. If there is a high medical needs member of the family who is in care, we definitely want to ensure that they know what their options are when it comes to continuity of that care. Next slide, please. These are a couple of, if you have seen me present before, you know that I'm all about building resources to a very excessive degree that no one really has time for. And yeah, I'm more realistic about that these days. However, considering what I think in theory you all are going to be looking at, I wanted to call attention to an old school resource where essentially for a given area, if you're working with specific counties, you can draft a summary of the various bronze and catastrophic plans sort of organized by the company, but in order of the monthly premium, which is how both these resources have done it, because it is tedious to have to open 25 different summaries of benefits and then pivot between them on a screen that's hard to read. Like, if it is possible for you to build something like this, I highly recommend it. If you would like any help with building something like this, I would love to help you. it is exceedingly useful. It's something that if one member of your team can kind of sit down and knock out right after plans are published later, much later in October, it will do you a world of good. It gives you kind of the high notes of the deductible, the out of pocket, but then also what things are covered pre-deductible if you fill it out like that. So yeah, not everyone wants to build this, which I respect, but it is quite useful if someone has bandwidth on your team. Next slide, please. I want to firstly point out that this says 2025 when it should say 2026. So you guys have probably seen different iterations of the 2026 FPL chart, but this is mine, or the one that my former entity foundation community used. I pointed out because of the specificity it has when it comes to the cost sharing reductions, being mindful of the fact that, you know, if somebody estimates their income different by $1, it can mean significant loss of that reduction in their deductible, their out-of-pocket max, and their co-payments, which is, of course, the whole point of that secondary source of financial assistance that sometimes I think clients forget about. They're too focused, or I mean, understandably, they're focused on the premium, but of course, if they're between 100 to 250% of the federal poverty level, they can be qualifying for tremendous savings when it comes to care. So that's why I like to use this chart. I also use this chart because you guys can see at the bottom, I have this red box that would remind the assister using this chart, and perhaps would cue you if you're working with a client, that there have been some changes, okay, that the American Rescue Plan had additional PTC, it ran from these dates, and then we had the Inflation Reduction Act. So this gives you, I think, the language to say, here are why premiums were less. This chart, right, is for this next year when we're not going to have these. And, you know, up to this amount, you're eligible for financial assistance. Above it, for the next year, you may not be. So just to make sure you have that language and can refer to the specific acts in case clients have questions about that. Next slide, please. I'm pulling a resource here from Center on Budget and Public Priorities, Claire's organization, and where I consult. So you can see that this is such a useful resource, and I'm certain it will be linked somewhere, but it's pretty easy if you search reference chart and FPL on their website, Beyond the Basics, you will locate this. So first and foremost, you'll notice a much more thorough and professional looking FPL chart at the top. But what I'm pulling from here, and why I might recommend that you flag this resource particularly, is I've zoomed in on what the 2025 premium contribution percentages were. And this is when, again, there was a little bit more financial assistance from the American Rescue Plan, from the Inflation Reduction Act, as was mentioned on the previous slide, on the previous chart, compared to this next year, which is outlined in red. So if somebody is looking at you like, what? Last year I paid this, now I'm paying this. I find being able to pivot to, yeah, if we pull this open, I'll show you that last year, right, you would have been eligible for a higher percentage of financial assistance. This year, it's different. Because you can see that the numbers, when they're lined up like this, don't look as dramatic, perhaps, as the dollar and cents amounts. But also, I think having a reference and a nice looking official one, thank you so much, Center on Budget, really instills confidence. Like there's a plan. It's not just chaos. This was a known outcome, right? It could change, but here's the information as we have it now. So I'm always going to recommend pivoting to the official resource where possible and pointing to it and giving them that data. It does help. Next slide, please. Okay, so I was really excited about this picture when I found it, and I am less excited about it now. I don't know what I was going for there, but I do want to say that keep calm and carry on. I always, it got so trendy, but originally this moment in time where Britain was under blitzkrieg and they're so British about it. Just be calm and don't worry about all that's going on. I think that that's something to consider because there's a lot of chaos and there's a lot of challenge and there's a lot of unknowns. But if we focus, I think, on the process and we focus on what we're trying to achieve, and we don't wave the red flag that this lovely woman is waving in front of what appears to be a leaking gasoline tank, we do a lot of good. I think keep in mind, every client you work with, you're going to get more and more drained and tired. That's logical. That's human. You're not a machine. You're a person. The client who's waiting on you is going to become more and more anxious to talk, right? They're understimulated, whereas you are overstimulated. So by design, you almost come into this interaction with the client like at very different places, which makes this complicated because you have to get them to trust you in, under an hour and a half, obviously, and get them to kind of respect all these confusing, ridiculous things that you have to tell them about healthcare. So I think more than anything, I point to a push button for walk because this is one of the examples of poor design that we see very frequent in society. You see people jamming that button over and over again because they don't know that their action has resulted in the outcome that they would like. And I think that's an important part to understand simply and to sympathize with. I trained a person I was managing up here on how to be a little slower because New Englanders are sometimes very like to the point and brusque, and how to be like, oh, God, I'm sorry for your long wait. Thank you so much for your patience, right? To kind of get human with them as opposed to immediately pivoting to be professional, which is understandably often the reaction. So I think try as much as you can to just be a human first. And I think this season that'll help us. Next slide, please. So I think the piece of this that I know I always lose, and Lynn and several other people on this call can probably attest to how wide my eyes are by the end of open enrollment and how wild my hair becomes. If you are not good, you're not going to be as good of an assister as you are, period, end of discussion. Like we all think that we can work harder than we can work. Most of us do, especially in this business. Please drink water. Please have snacks, and try not to have the snacks that I think we tend to feed clients, the chips and the candy. Have some almonds or something, right? Have some protein. Remember to get up. Remember to breathe, to step outside. This is a seriously hard job. It's a wonderful job. It's an important job, but it is incredibly draining, and people will make a lot of demands on you. Please don't skip meals and breaks. Lynn and I used to joke about when we knew open enrollment was going because we'd both be in a kitchen at like 2 a.m. eating things we just found because we hadn't eaten all day. Please don't be that people. This is not the season for that. Next slide, please. Finally, we have these two Swedish kids enacting a biblical scene. Why did I pick this slide? It's a weird picture. Anyway, keep in mind, even when you leave without having enrolled a client, even when a client is mad, you have helped them understand something. And I think when you can do that kindly and gently, you are giving a gift that people don't get very much as adults. So I think more than anything, if our focus this season is on kindness and is on sharing and not being a border or a barrier to that information, I think you've done something very important and you're helping people weather the challenges of the coming year. So please keep that in mind, and please be gentle with yourselves. Next slide. I'll say it again, Texas Sisters have to navigate some of the most challenging challenges I can even believe, and y'all are the best in the business. It kind of chokes me up a little. Please reach out if there's anything you think a question I could answer, a resource you would like yourself. Please use that FPL chart. I'm going to get the updated one that says 2026 to Sonia, so that can be shared out. But my email is under my name. Thank you all so much for what you do and you're about to do. I'm honored to chat with y'all.
Wonderful. Thank you so much, Ariana, for that great advice and for those words of encouragement. Certainly very much needed at this time. Thank you, Claire, also for your presentation. Again, apologize for having that one slide out that I really wanted us to emphasize was the Medicaid gap SEP. So I'll make sure those are included in the slides that get out to people. There is just a request actually on the Q&A that I'm looking that the detailed charts will those be available outside of the presentation? I guess they want a little more blown up. So maybe if you could send them to us separately outside of your chart, or I mean, outside of your presentation, so that people can see that, that would be really helpful. A lot of great positive comments on the chat for this presentation. So we appreciate that feedback. I'm gonna go ahead. I don't see any other questions. So I'm gonna go ahead and pass it over to Katie for our closing process.
Thank you so much, Sonia, and thank you so much, Claire and Ariana, for your presentations today. As a reminder, all resources, materials, recordings, slide decks will be shared post-conference. And now that we are at the end of our second session today, it is time to launch our second poll. So our Zoom administrator is going to launch the poll. I am actually going to be reading the poll out loud, so our interpretation channels can read it out loud as well. As a reminder, we are doing these polls to capture any learnings that you had from today's call, but this is also your opportunity to be entered in for a chance to win a $50 gift card. And so while I am reading these out, my colleague Simona will be getting that wheel ready to spin. So the first question, number 1, I have a better understanding of special enrollment periods available in the marketplace. I strongly disagree, neutral, agree, strongly agree. Number 2, I learned about new policies impacting special enrollment periods, including new additional documentation requirements. Please choose one. You either strongly disagree, neutral, agree, or strongly agree. Number 3, I better understand how to communicate with care for the newly uninsured and some tips for self-care for enrollment assisters. I either strongly disagree, neutral, agree, or strongly agree. Those are our 3 poll questions. And with that, Simona will be spinning our wheel to see who is going to be our winner of our 3rd gift card. And as a reminder, this poll is only in the actual Zoom webinar. It is not in the lobby chat or in the lobby space. And we're spinning the wheel. And it looks like our session 2 gift card winner is Olga Cedillo. Olga, if you are here, can you give us a little raise your hand function or a response in the chat box? Again, our session, there she is. Congratulations, Olga. We will be reaching out to you post-conference to make sure you get your prize. And on the next slide, Thank you, Sara. We are officially entering our lunch break. So as Ariana said, let's make sure we're putting some yummy food into our body, drinking some water, maybe stretching, going for a quick walk. Our next session will not be starting until 1 p.m. Central Time. And that session will be the state legislative overview and policy changes and their effects on Texas enrollment and utilization for HHS and marketplace programs. So again, we're having a lunch break and we will be back same place at 1 p.m. Central. Thank you again to our speakers and our attendees, and we will see you at 1 o'clock Central. Thank you so much.